Hey everybody, this is Dr. Haley again. In a previous video we talked about instrument adjusting using the Impulse instrument adjuster. And now we have a live patient that we can demonstrate on. And it's a pre-screened patient, so you're not going to see me actually do the evaluation that we did prior to the camera work. But we're going to show you the areas that we need to treat. Now in a prior video we showed you about the 3 different styluses that we have. This stylus right here is thick, and it's a double stylus which we like to use for the sacral area. This particular patient has a sacral base misalignment that we want to correct. What I do is I place the stylus right in the area and I give a little push so I kind of see where I need to be. Now I'm going to give one impulse to just show you. Boom, right there is a single. This would be the double, and on her case we need to do multiple because we really want to move that bone. So I have it on the second setting and I give it some multiple. Now later on we'll check and see if that joint moved, but we can give a little palpation here and we can see that. Now we want to move up to the thoracic spine and she has some misalignments in that area. We're going to change the stylus heads. And I am going to put on the smaller double one because we want to get bone movement from a posterior to anterior motion. We screened her before. We found out that she had a subluxation misalignment in this area here. She's actually more on the right, so I'm going to put a little more pressure on that right, and we're just going to go here and here. I'm also going to back that up one segment above I just found with the single, and the single is for one side of the spine, and we're going to go right here, right where I need to go, and we'll give her setting 1. And we just have to make sure this works. There you go. And just give her 1-2 punches. Now we're going to go up to the cervical spine here. What I like to do in the cervical spine, and like I said, we pre-screen this patient, is we want to give a P to A motion around C5 because she has a little bit of a loss of a curve. So what I would do is have her just raise her head just a little bit. There she goes. We come down where we need to move, and it says C5. We keep it at setting 1, and I'm just pushing down there, and I'm giving her a single, and I'll give her one more just to see that move. Perfect. Now what we do is we're going to check the individual vertebra, and like I said, we pre-screen this, so I know where I need to work, but I want you to see this. Turn your head this side. Just rotate your head. Okay, now how about back this way? Turn it this way. Okay, back to center. Okay, and she was a little bit off going to the right. She's out of alignment right there, and we just give a single impulse to that area, and we can recheck by palpation, and then follow up with range of motion. Turn this way here, and back. That was a little more crisp. She feels a little better here. Later on, we'll do a motion palpation, and we'll do some leg check, evaluation, and some muscle testing. Make sure the adjustment held. Once again, these impulse or these instrument adjusters are very good. They're for patients that are a little scared of getting the traditional, what they would call cracking type adjustment. It's great for kids. It's great for senior citizens. It's great for athletes because we can do a lot of extremities with it. You can do a lot of stuff with this electronic impulse instrument here. And once again, don't wait till it's too late to see your chiropractor. Yours in health.